Next, we're going to do the head, neck, and lymph node exam. First, we're going to start with inspection. We're going to look at the head. It's round, it's symmetrical. We're going to feel for any kind of lumps, any kind of tenderness. The scalp is clean. Next, we're going to check for the TMJ. If you open your mouth, open up and down. No crepitus. Is it tender?
No.
Are you able to move it from side to side, your lower jaw?
Yes.
All right. We're going to palpate the frontal sinuses. Any tenderness?
No.
We're going to do the maxillary. Any tenderness?
No.
Next, we're going to do the thyroid gland. We're going to do from behind. We're going to feel. It's smooth. Can you turn your head to the side? Swallow for me. All right, to the other side. Swallow. And here you would note any kind of nodules, if it's asymmetric. There's none of that here. His is symmetric. I can feel it moving on each side. It's smooth. We're going to listen with the bell of our stethoscope for any bruise. And no bruise are heard. Next, we're going to do the cervical lymph nodes. We're going to start with the preauricle, which are in front of the ears. And we're going to palpate everything. They should be less than a centimeter. Postauricle, at the angle of the mandible, we're going to do the tonsillar. And you're going to use the pads of your fingers on both sides. We're going to do submandibular, submental under the chin. We're going to go ahead and do the occipital, which is at the base of the skull. We're going to do the posterior cervical at the back of the neck. We're going to do the anterior cervical at the sternocleidomastoid muscle. Turn your head to the side. We're going to do the deep cervical ones to the other side. Deep cervical on this side. And these most of the time are not palpable. They're not palpable on him right now. And then if you can put your arms forward, we're going to feel for the supraclavicular. All right. All lymph nodes are less than 1 centimeter. They're palpable other than the deep cervical. Next, we're going to do the otoscope. Thank you. So when you do the otoscope, you're going to invert it. That way, you have your forearm to hold the patient's head steady. For an adult, the pinna of the ear goes up and back. And you look in, you look at the tympanic membrane, you look at the reflective light. In the right side, it's going to be, the light's going to shine at 5 o'clock. In the left side, it's going to be at 7 o'clock. And inside the ear canal, you're going to look for any kind of nodules. You're going to make sure that it's pink and that you see the tympanic membrane, that there's no bulging, no fluid, or any of that noted. For the ophthalmoscope, you'll turn it on, make sure that the light works. Also for the otoscope, you make sure that you always put a protective covering in between patients on it. For the ophthalmoscope, make sure that the light works. You stand in front of the patient. You have them focus on a point behind your shoulder, and you use the light to look into their eyes. You look for the red reflex and all of the visual, the discs and everything in the eye with the ophthalmoscope. And that's going to conclude our head, neck, and lymph node exam.